Hello all, welcome to another session of Nurse Talk. Today we are going to see the different types of pulses and which are disease condition with this pulse is seen. Okay, the first graph in here, it shows the normal pulse. The normal pulse rate of a human body is 60 to 100 beats per minute, and it can be shown in a graphical representation like this. This will be a normal pulse rate. Okay, and now we are going to the hypotonic pulse, or it is also known as a weak pulse. This can, some disease condition, we will call this pulse as thready pulse. Thready pulse or hypokinetic pulse is a low amplitude. It's a low amplitude and weak arterial pulse. It is mostly seen in disease conditions like heart failure or aortic stenosis. These disease conditions, in this disease condition, most common symptom or sign is a hypokinetic pulse or a thready pulse. Okay, seen in disease conditions, heart failure and aortic stenosis. Now we're going to hyperkinetic or bounding pulse. You see the hyperkinetic or bounding pulse. You can see the difference between a normal pulse and a hyperkinetic or bounding pulse. You can see this here. It is a large, it's like a large bounding pulse. Sometimes it's also known as Waterhagen or Corrigan's water hammer pulse. But we have another water hammer pulse here. We will see the difference between that. Sometimes it's also known as Corrigan's pulse. And it is like a strong pulse. It's a strong pulse. It is a hyperkinetic pulse. It is large and it is caused by large volume of blood ejected rapidly by the heart. When the heart ejects large volume of blood, this type of pulse or hyperkinetic or bounding pulse is seen. Disease conditions commonly manifested by bounding pulse is aortic regurgitation, patent ductus arteriosus, and arteriovenous fistulas. So mostly seen in aortic regurgitation, PDA or patent ductus arteriosus, or arteriovenous fistula. If the patient has arteriovenous fistula, then the patient can have a bounding pulse or hyperkinetic pulse. Also in some hyperdynamic cases like increased temperature or fever of the patient, or anemia, if the patient has a anemia, or thyroid toxicity like hyperthyroidism can also in such conditions also hyperkinetic or bounding pulse is seen. So we studied about the normal pulse. The normal pulse rate would be 60 to 100 beats per minute, and then we went to hypokinetic or weak pulse, that is also known as thready pulse, mostly seen in the disease conditions of aortic stenosis or heart failure. Then we went to hyperkinetic or bounding pulse, seen in aortic regurgitation, patent ductus arteriosus, and also in hyperdynamic conditions like fever, anemia, or hyperthyroidism. Okay, so now we are moving to the bigeminal pulse. Pulses bigeminous or bigeminal pulse. You can see it in this graphical representation here. Two heartbeats are very close together. We can see two heartbeats here. Heard or listen, we can listen to these two heartbeats very close together, and there will be a longer duration after one. Once we listen or palpitate to one pulse, which is often coming up together with 1 and 2, and then we'll be having a longer period of duration between the first one and the second one. Okay, when we are palpating a patient with bigeminal pulse, two heartbeats are close together. We can feel two heartbeats close together, 1 and 2 close together, and it will take a longer period for the palpitation of the next one. Okay, this is called bigeminal pulse. Bi means two. So remember, two heartbeats are close together in bigeminal pulse or pulsus bigeminus. This condition is mostly seen in disease of myocardial infarction. Okay, remember, bigeminal pulse is seen in myocardial infarction. And next we are going to pulsus alterans. Pulsus alterans is a pattern of one strong and then one a weak pulse. Alterans means alternatively, one strong pulse and a weak pulse, and again a strong pulse and a weak pulse, strong pulse and a weak pulse. This is pulsus alterans, most commonly seen in left ventricular fibrillation, heart block, or in digitalis toxicity. digitalis toxicity. Digitalis toxicity is a very important topic for the MCQ examinations. Okay, this is caused because of the overdose of digoxin or not assessing the pulse rate of a patient, and if somebody is providing digoxin, and the patient can go to digitalis toxicity. So in case of digital toxicity or heart block or left ventricular fibrillation, the patient can show pulses alternates. Remember, alternates means alternatively. So one strong pulse and a weak pulse, one strong pulse and a weak pulse. That how pulses alternates is shown. Next one is water hammer pulse or collapsing pulse. Water hammer pulse is similar to the bounding pulse. So like a similar to the bounding pulse, and there is forceful pulse rapidly increasing. It is rapidly increasing. You see the time between this graph here. It is a bounding pulse, and this is a rapidly increasing pulse and subsequently collapsing. Whenever somebody says your terminology water hammer, remember the term collapsing. That means once the pulse starts and it is bounding and it is forceful, then it starts collapsing. Then it starts collapsing here. So that is a water hammer or collapsing pulse, typically seen in aortic regurgitation. Typically seen in disease condition of aortic regurgitation. Water hammer pulse is typically seen in aortic regurgitation. The next type of pulse is pulsus bisferens. Pulsus bisferens. This is like fingertips. Our fingertips, when we palpate the patient, the fingertips will receive 2 pulses to each heartbeat. Normally, for one heartbeat, we receive 1 pulse. If the patient has a bisferens, pulsus bisferens, again the bi is coming here, bisferens, we will be able to palpate 2 pulses in 1 heartbeat instead of 1. If normally we will palpate, see the normal pulse, we will palpate only 1 pulse in a heartbeat. In here we are palpating 1 and 2 pulses in a heartbeat. So this is called pulsus bisferens, normally seen in aortic valve diseases. Pulsus bisferens is normally seen in aortic valve diseases. So remember the difference between bigeminal pulse and bisferens pulse. In bigeminal pulse or pulsus bigeminus, 2 heartbeats are very close, 2 heartbeats, but they are still 2 heartbeats are heard here. In bigeminal pulse we have 2 heartbeats. The thing is they are very close. But in case of bisferens, we can palpate 2 pulses in 1 single heartbeat. 1 single heartbeat we'll be able to palpate 1 and 2 pulses. So that is the difference between pulsus bisferens and bigeminal pulse or pulsus bigeminal. Hope you got an idea about the types of pulse. Thank you very much for watching. See you next session. Bye bye.